So the microsite that we've tried our best to show you, but we're not brilliant with modern technology, as you probably gathered, was something that was produced, and I have to say to you, one of the learning things about this project was that the care home teams preferred the training and the hard copy handbook. Out of that microsite's use of the pilot, which took place for 4 months, only 107 hits took place on that microsite, whereas 1,000 books went out. And in terms of worksheets, we printed 45,000 as a part of that project, so the care homes didn't incur the cost. So the hard copy materials were taken on board to a much higher level than the IT. There's lots of reasons for that. It could be the fact that there isn't a lot of training for IT within the care homes, access to the actual IT itself, or the fact that some of the care home teams felt that if you look at a computer or an iPad as opposed to a sheet with the person at that bedside, you start to focus on the technology as opposed to focusing on the person. So there's lots of findings to come out. Basically, the quick diagram there, because I'm very conscious of time, shows all of that integration that we spoke about in terms of developing these tools. The commissioning groups have been exceptionally superb in supporting this because they all see the social and health value in this project in terms of the fact that it does add social value to someone's life, that care homes are an area that we do need to invest in, not necessarily in terms of money, but in terms of resource and engagement and respect and commitment. So what did the actual project show in terms of statistics and results?
Okay, so these are the statistics and the results. The baseline, obviously, we can show by midpoint we definitely had some good interventions and some good outcomes. However, there was 9 homes and 8 homes returned for both of these. So at midpoint in June, this was when the training was happening, so we were going in, we were engaging with the teams and the staff, and we had a really good outcome.
Cost savings.
And that was the cost savings.
Bear in mind that the pilot took place for 4 months. During those 4 months, sorry, mind your way.
No, you need to come.
Oh, sorry, it's because I'm normally so loud I don't need a microphone. Basically, what we're showing is that in those 4 months, the cost savings equated in terms of like national metrics to £67,000. Now, obviously, if that could have become a social transformation programme, the cost savings over a longer period could have actually projected into millions, but that requires a sustained approach.
And then, at the end of the project, we actually look like in some areas that we've increased our pressure ulcers, catheters, and our falls. However, there are only 4 homes that completed the whole audit. And some of those areas, like the pressure ulcers, they're actually reporting all their pressure ulcers, not just the ones that they'd acquired. So it could be that they'd had new residents with the pressure ulcer. And that's something that when you work on a project, that actually you look back at that project, don't you, and you make recommendations from that project. So they were our end points.
These were the main project headlines that we found, and the main project headlines that we found, strangely enough, aligned to a lecture that I went to with Norman Lamb. Well, it wasn't a lecture, it was a discussion really with an AGM at Healthwatch. And Norman said that the health service required 5 fundamental shifts in terms of his vision for where things needed to go. And when we actually looked at this, you're going to think, well, how's mouth care anything to do with Norman Lamb? Let me quantify that. Because what Norman actually said that the health service needs in terms of a change of vision and direction, particularly with the way forward with the economy and the changing demands, is early intervention and prevention. And that's what the project permitted with the use of the tool and the education and the engagement of the staff. Also, it was paramount to him in his culture that a holistic approach, both physically and mentally, in terms of spiritual and emotional well-being as well, was actually the citadel of where we need to go forward. Working in partnership as an integrated whole was the third point. Also, the safety culture of an organisation is very important. We've spoken about the culture of care, but the safety culture of each organisation, whether it be a provider trust, whether it be a commissioning, whether it be a care home, it's what kind of human factors engagement do we have within those cultures. And probably one of the most important things, the development of a collaborative community where everybody's working in a consistent way, not just towards an integrated approach where there's co-location, but this co-partnership and co-outcomes where people will actually feel that the whole of that journey is a seamless journey of integration of quality. And what we'd like to finish on, because fundamentally we're both nurses, is that this is one of our favourite quotes that we feel that the project did achieve with the help of most of the people in this room and the care home managers who we owe a huge debt to and their teams. Florence Nightingale always used to say, well, many things, but one of them was that to actually take those thoughts and distill those thoughts into actions which bring about results. And we're hopeful that the future of this project as a programme will bring about positive outcomes, not just quantifiable results in terms of money, but that tangible outcome for that person's voice if it is only a whisper. Thank you.